morning, everyone. Good morning. Dr. Tioma LaShawn here with Body Soul. And it has been a couple weeks because I was completing the faculty residency here at Duke University, and I'm finished and I'm so excited. Yay! So the faculty residency, physical therapy has many types of residencies. Most of them are clinical. So you might have a residency in orthopedics or women's health or pediatrics. But my residency was faculty based. And so I was fully immersed in the faculty at Duke University's physical therapy program, teaching classes, engaging with students, advising students, assisting with clinical education, all the things, completing research. So finished my research topic and presentation. So even though we're officially done, I still have to write a paper for publication. So I'm looking forward to that coming out soon. So I'm finalizing that. So I'm not quite done with that, but that's like the last thing that I need to do. So just wanted to give you all an update on just what I've been doing. But today I have the foam roller with me. So I think I want to do a series on foam rolling and its benefits and everything. So let's talk about that. So a foam roller is one of the tools that physical therapists use to prescribe exercise to patients for self-management and self-care, soft tissue mobilization. So there are different types of rollers. So this is a long one, I believe about 16 inches or so. And you see it's black, so that means that it's very dense. And so this is not necessarily a starter foam roller. You typically want to start, if you haven't foam rolled before, you want to start with a white one so it's less dense. And depending on the area that you're going to be rolling, they have different sizes. So they have some that are this size. They have some that are about half the size, and then they have the long ones. There are also rollers out there that have like all the ridges and the bumps and everything. That's typically not necessary. Yeah, a straightforward foam roller will do just fine. If you use the ones with the bumps and everything, you might just end up hurting yourself or bruising yourself, kind of. You don't necessarily need that. I never really recommend that to any of my clients or patients. So I wanted to start with, you can foam roll for a variety of different reasons, and we'll go over it in the series. But today I think I'll start with the calves, just because I think my calves can use a little foam rolling, and I'll go ahead and foam roll, and then I'll talk about it as I'm doing it. So let's get into it. Okay, so I'm going to demonstrate foam rolling my calf muscle, or the gastrocs, and the soleus. So the gastroc soleus complex, that's the lower portion of the leg. So a lot of times people will have pain in their foot, like plantar fascia or Achilles tendon pain, or just tightness within the calf muscles that might affect your walking or running. And so foam rolling can be a great adjunct to stretching. It's a way of you giving yourself some soft tissue mobilization. And so I'm going to demonstrate what that can look like. So if people are strong enough, which I don't think I'm really that strong, as far as to hold myself up. So some people can lift themselves up on their arms and kind of just roll their calf like that, but I get tired fast. My arms aren't that strong. So I just drive my leg into the roller. So it looks like this. I'll just start rolling, and I'm just driving my leg into the roller, and I will work it all the way up the calf like that. So doing the entire calf muscle is important, and you'll feel like where it's really tight And then once you go up the entire calf a few times, then you can start to focus on those areas that feel more tight than usual. So all I'm doing is just, as I'm pulling up, and then I'm just driving my leg into the roller. So up, drive, up, drive, up, drive. I like to focus on the inner calf because that's typically the area that gets tightest for people. And the calf muscle anchors at the heel. The calf muscle anchors at the heel via the Achilles tendon. And so it's important to work on the calf muscle. Some people don't always make that connection. So the medial calf or that inner calf is typically the one that bothers people the most and is typically the tightest. So I do this for about, I can go for like 10 minutes, but I just recommend at least 5 minutes or so. Let me back up. I recommend 5 minutes every other day. This is not something you want to do every day. I don't typically recommend every day, but I do recommend like every other day, especially if you're having some Achilles discomfort or calf tightness, and I think that will be a great adjunct for you. So continue to stretch. Stretching is important, warming up is important, all of that's important. This is just something that can help enhance and speed up your recovery, okay? All right, I hope that helped. Let me know if you have any questions. This is Something for Your Body with Dr. LaShawn.